Sinus infections and ear infections are common conditions that affect millions of people every year, often causing discomfort and pain that can disrupt daily activities. A sinus infection, also known as sinusitis, typically manifests with symptoms like a stuffy nose, facial pain or pressure, and thick nasal discharge, whereas an ear infection or otitis media may present with earache, hearing difficulties, and fluid drainage from the ear. Treatments for sinus infections may include decongestants, nasal sprays, and antibiotics if a bacterial infection is suspected, while ear infections might be managed with pain relievers, warm compresses, and also antibiotics in certain cases. Individuals with allergies, frequent colds, or structural abnormalities in their sinuses or Eustachian tubes are at a higher risk of developing sinus and ear infections, respectively. Understanding the differences and similarities between these two infections can help in seeking prompt treatment and relief. Here's a look at the detailed aspects of each disease to help distinguish between the two and understand their implications on health. Location of infection: sinuses versus Eustachian tube. Sinus infections and ear infections both affect the upper respiratory system but target different areas. Sinus infections, or sinusitis, occur when the nasal cavities become inflamed, often leading to pain around the forehead, cheeks, and eyes, accompanied by congestion and sometimes fever. On the other hand, ear infections, or otitis media, involve inflammation and potential fluid buildup in the middle ear. The Eustachian tube, which connects the middle ear to the throat, is often the troublemaker here. When blocked, it provides a breeding ground for bacteria, resulting in sharp ear pain, possible hearing loss, and in children, tugging at the ears. Identifying the exact location of discomfort helps clinicians in making an accurate diagnosis and prescribing the right treatment, be it decongestants, antibiotics, or other interventions. Primary symptoms: nasal congestion versus ear pain. Sinus infections and ear infections are common ailments that affect people of different ages, often causing discomfort and a range of symptoms. Sinus infections primarily result in nasal congestion, facial pressure, and a discharge from the nose that is often thick and yellow or greenish in color. On the other hand, an ear infection typically presents with ear pain, which can be sharp, sudden, or dull and lingering. Patients may also experience hearing loss or a feeling of fullness in the affected ear, and it's not uncommon for young children to exhibit irritability or tugging at their ears when suffering from an ear infection. While both conditions can arise from similar viral or bacterial infections, their primary symptoms are key to a differential diagnosis, guiding appropriate treatment approaches. Affected senses: smell and taste versus hearing. Sinus infections primarily impact the sense of smell and taste due to inflammation and blockage in the nasal passages. Patients often report a loss of these senses along with sinus pressure, headache, and a congested or runny nose. In contrast, ear infections tend to impact hearing. The buildup of fluids in the middle ear can lead to a feeling of fullness, muffled hearing, or even temporary hearing loss. Discomfort or pain within the ear, especially when lying down or chewing, is common. Although both conditions may result in discomfort and fever, the key distinguisher lies in whether the sense of smell and taste or hearing is predominantly affected. Typical onset: allergens, irritants versus fluid accumulation. When differentiating between a sinus infection and an ear infection, the typical onset plays a crucial role. A sinus infection, or sinusitis, often begins when allergens or irritants trigger an inflammatory response, leading to nasal congestion and sinus blockage. You'll notice pressure around the nose, cheeks, and eyes, often with a headache and colored nasal discharge. On the other hand, an ear infection often originates from fluid accumulation, possibly after a cold. The trapped fluid in the middle ear breeds bacteria or viruses, leading to pain, a sense of fullness or pressure in the ear, reduced hearing, and sometimes discharge. Children are particularly prone to ear infections due to their shorter Eustachian tubes. Identifying these onset patterns is critical in diagnosis and treatment. Common complications: sinusitis versus otitis media. Sinusitis, or a sinus infection, often presents with facial pain, nasal congestion, and a loss of smell. When it becomes chronic or is not treated properly, it can lead to complications such as orbital cellulitis, meningitis, or a brain abscess due to the proximity of sinuses to the brain and eyes. On the other hand, otitis media, an infection of the middle ear, can cause persistent pain, hearing loss, and in severe cases, it can result in tympanic membrane perforation. Chronic otitis media may lead to cholesteatoma formation or mastoiditis. Both conditions might contribute to chronic inflammation that, over time, could potentially diminish one's quality of life. Thus, accurate diagnosis and timely treatment are essential to prevent such complications and ensure overall ear and sinus health.